Welcome to the February International Journal of Gynecological Cancer Conversation, the Editor Choice, where we explore the latest research in gynecologic oncology. I'm Matteo Marchetti from University of Padua, Italy.
And I'm Thomas Bartl from Medical University of Vienna, Austria.
Hi, Thomas. So, have you read the recent IJGC-led article by Evan Gibbard and colleagues from the University of British Columbia on oral contraceptives and fallopian tube p53 signatures?
I have. It's a really interesting concept. Authors explore how the use of oral contraceptives may reduce ovarian cancer risk by affecting early precursors in the fallopian tubes, right?
Exactly. P53 signatures are essentially abnormal areas in the fallopian tubes that are thought to be an early steps in the development of high-grade serous ovarian cancer. So how did they approach the study?
Authors conducted a retrospective cohort study with 250 women over the age of 50 who had their fallopian tubes removed during benign gynecologic procedures. Out of these, 72 had used oral contraceptives for the last 5 years, as compared to 178 who hadn't used oral contraceptives at all. Authors used immunohistochemistry to identify p53 lesions in the fallopian tube tissue. They identified and measured the size of these lesions, categorizing them as small, medium, or large, and then they ran logistic regression models to associate oral contraceptive use with the p53 lesion size.
Okay, so a retrospective data looking into benign procedure removes tubes to find if OCP use had association with p53 lesion size. What were the main findings?
Interestingly, the overall incidence of p53 lesions was similar between the two groups, about 29% in oral contraceptive users versus about 33% in non-users. However, women who had used oral contraceptives were more likely to have smaller lesions, with an odds ratio of nearly 2. They also had a significantly lower risk of having medium or large lesions, with an odds ratio of 0.38, meaning that oral contraceptives appear not to be linked to the incidence of p53 lesions, but to smaller lesion sizes.
That's a notable difference in lesion size. And were there any findings related to more concerning lesion, like serous tubal intraepithelial carcinomas or STIC?
Yes, they also identified 2 serous tubal intraepithelial lesions, so-called STILs, and 2 serous tubal intraepithelial carcinomas, STICs, in patients with no history of oral contraceptive use, but none in the patients with a history of oral contraceptive use. Even though interesting, however, this number is obviously too small to draw meaningful conclusions today.
So it seems that while oral contraceptive use doesn't reduce the overall number of p53 lesions, it might limit the growth and progression.
Exactly. This study suggests that oral contraceptive use may be associated with a shift towards smaller p53 lesion sizes, which could be a mechanism behind the reduced risk of ovarian cancer. Based on available data, this hypothesis appears compelling, but of course remains hypothetical. Authors highlight that future research is necessary to confirm present observations and see if oral contraceptive use can actually prevent these early precursors from evolving into higher risk lesions.
That's a really promising insight into cancer prevention. Thanks for breaking it down, Thomas.
My pleasure. It's exciting to see research that helps us understand these preventive mechanisms better. Besides the lead article, could you share with us the Editor's Choice article of February?
So one of the other choices is titled Molecular and Microenvironmental Landscapes of HPV-Independent Invasive Squamous Cell Carcinoma of the Vulva, led by Sarah Mufaraj at Memorial Sloan Kettering Cancer Center. As we know, HPV-independent vulvar cancer squamous cell carcinoma generally has a worse prognosis compared to HPV-associated cases. The study aims to dig deeper into what sets these tumors apart at a molecular level and in terms of their immune profiles.
So, how did the researchers go about it?
They identified primary untreated vulvar cancers from 2006 to 2016 and used a combination of pathology review, P16 immunohistochemistry, and PCR for HPV types 16 and 18 to accurately classify the tumors. Out of 93 cases, 19 were confirmed as HPV independent.
And then they performed targeted tumor normal panel sequencing along with nanostring gene expression analysis on these HPV-independent cases, right?
That's correct, exactly. The sequencing revealed recurrent mutation in key genes. TP53 mutation were present in about 68% of these cases, while mutation in FAT1, NOTCH1, and CDKN2A were also observed. Interestingly, 26% of the HPV-independent cases has a dominant UPBAC mutation, a mutational signature, whereas the rest exhibit clock-like or agent-related mutational patterns.
That's really intriguing. It suggests there are different mutational processes at play within HPV-independent tumors. What about the tumor microenvironment?
The study used multiplex immunofluorescence to analyze the immune landscapes. They found that these tumors were characterized by an infiltration of CD8 plus and PD1 plus T cells interacting with CD68 plus and PD1 macrophages. This immune active environment might have implication for the treatment as it hints at a potential for immunotherapy strategies.
And didn't they also look at gene expression profiles related to immune response?
Yes, they did. They observed that in primary HPV-independent tumors that did not recur, there was significantly higher expression of immune-related genes like CXCL8 and HLA-DRB5 compared to those that recurred. This suggests that a more robust immune response might help control tumor progression.
So in summary, the study shows that HPV-independent vulvar squamous cell carcinoma is a heterogeneous disease with distinct genetic mutations and a unique immune-active microenvironment. These insights could be critical for developing targeted therapies in future.
Absolutely. While these tumors typically have a poor prognosis, understanding their molecular and immune profiles open up new avenues for personalized treatment strategies. It's a step forward in tailoring therapeutic approaches based on tumor-specific characteristics.
Thanks for breaking down the study. It's exciting to see how this kind of research can potentially change clinical practice and improve outcomes for our patients.
And tell me, what is the other editor choice about, Thomas?
It's a systematic review of patient-initiated follow-up in low-risk endometrial cancer after surgery by Leek and Leach from King Edward Memorial Hospital in Australia.
That's great. So, what's the main goal of the study?
The objective was to evaluate how patients-initiated follow-up affects quality of life, survival, and healthcare costs in women with low-risk early-stage endometrial cancer, specifically stage 1A, grade 1 and 2 tumors treated with surgery alone.
Very interesting. And how did the researchers go about it?
They conducted a systematic review by searching databases like Cochrane, Medline, and NBase, including studies up to August 2024. They focused on randomized controlled trials, cohort studies, and observational studies that looked at this specific patient group.
And what outcomes did they focus on?
The primary outcome was quality of life. They also looked at secondary outcomes like overall survival, cancer-specific survival, recurrence-free survival, healthcare utilization, and adverse events.
So what did they find?
They included 6 studies with a total of 1,081 participants, 1 multicenter RCT, and 5 cohort studies. Overall, patient-initiated follow-up didn't negatively impact quality of life or increase fear of cancer recurrence. In a subset of studies with 853 patients followed for 10 to 60.7 months, there were only 22 recurrences, and overall survival ranged from 93 to 100%.
So interesting. So that suggests that patient-initiated follow-up could be a valuable option for this patient, right?
Exactly. It appears to be an acceptable approach for low-risk patients, although the evidence in long-term survival is still limited.
It's promising to see an alternative follow-up method that might reduce unnecessary clinic visits without compromising outcomes.
Absolutely. This study provides a strong rationale for considering patient-initiated follow-up in appropriate cases, potentially improving patient convenience and lowering healthcare costs.
Thanks again for breaking that down. It's an exciting development in the follow-up care for low-risk endometrial cancer.
My pleasure. That's all for the February IJGC Conversations Editor's Choice. Remember to tune in March.